National Nurses Week, and today we are celebrating nurses with two guests from the Center for Family Health, nurse practitioner and RN Tracina Christensen and RN Clara Van Dusen. Welcome to the show.
Thank you. Thanks for having us.
Yeah, and congratulations on National Nurses Week, and thank you for your commitment to the profession and to our community.
Thank you.
So nursing, very challenging job.
Can be.
And in this day and age, we see some additional challenges. Post-pandemic, staffing shortages.
Yes.
Probably not a day that goes by that you don't face a new challenge.
Yep. Mm-hmm.
What about the profession that attracted you, Tracina? Why did you want to be a nurse?
Oh my gosh, actually I never did want to be a nurse. I didn't even know what that really meant. I just one day thought, oh, I'm going to be a nurse, and kind of through the experience of being a nurse, it was like, oh, now I see how I fit into this. And
was there a nurse or a health professional that maybe provided a little inspiration for you?
Oh gosh, all the way. I mean, I've been in nursing for 22 years, so I've had a little bit of experience. So every step of the way and with everything that I've done, there's always been somebody where I've been like, oh, wow, she's smart for that, and I like how this person does this.
So you're an RN and a nurse practitioner. What does that mean?
Well, I went back to school. I've gone to school a lot because you're always learning, obviously, as a nurse. I think Clara can agree to that. But, you know, I was an RN, and I thought I wanted to do nursing a little bit different in the way that I provide care to patients. So I went back to school and got my master's degree and a certification for a family nurse practitioner.
And it's really, for some families like mine, I remember as our kids were growing up, every time we brought our kids to the doctor, it was actually the nurse practitioner every single time.
Yeah. We just kind of fill in the spaces when we need to,
And how about you, Clara? What inspired you to get into nursing?
Well, I worked in a long-term care facility as a nurse's aide right out of high school, my senior year, and I just noticed a lot of, I actually always thought I would be in long-term care, but so nurses there, I'm thinking, well, I can do this. I can do what they're doing. And then you don't realize there is a lot of work behind what they're doing, different than a nurse's aide. So, and I also always thought I would like somebody to be there when I need care, more in the elderly age, that you think you can't be independent or something. So that's really what piqued my interest back then. But I have gone into women's health because, you know, I do like to teach women to take care of their body, to know what is happening and why things are happening. So I've been in women's health for like 30 years.
Wow.
Yeah.
So long-term care, so nursing homes?
Yes.
And
yes.
really, my mother-in-law and my mom were nursing facilities, and the people that work in, it's a special breed of person that works.
Yeah, for sure.
Yeah. You have to want to.
You develop a nice relationship with them, and yeah, you're right. You want somebody to be there when it's your turn.
And I like that attitude. You want to, when you're older, you want someone like you taking care of you.
Right.
Yeah. And I think a lot of us in society, we look at, you know, how generally we take care of our older population, and it's not the greatest sometimes.
Right. Yeah.
Taking care of people's hard all the way around sometimes. So.
Now, at Center for Family Health, you can specialize. You've got several areas you can specialize in. You mentioned women's health. Tracina, are there some areas that you'd like to work in?
Well, right now I'm in women's health, and I've been all over the centers. I've worked there since 2001. So I started in pediatrics and ended up in women's health, left for a little bit to get my master's degree. So I'm back in women's health. So there's just a lot to learn, specializing in just women itself. So I've just been there enjoying myself and learning. And
I think the respect we have for the profession has improved over the years. When I was a kid, I remember nurses were almost exclusively female, and I witnessed the way some nurses were treated by doctors or administrators, and it wasn't the best.
yeah.
you've grown as a profession.
Yeah, and
The
we've
standing.
got a really good team at the center. Yeah, they really take really good care of us and really respect us. So it's been great.
The challenges of COVID, what was that like, treating patients during the pandemic?
Just difficult all the way around. Well, I was in school for my master's degree at that time too,
Oh.
so there's a lot of delays with that, and then just everything new, working new rules and what patients we could have available and their support staff around, and just how to approach every single different detail. And we just had to become creative.
And the lack of, personal connection because of the mask and distancing.
Right.
That had
Just
to have
caused
been-
some delays and made it really hard to follow up with people if they needed something. So, yeah, but we're getting caught up now.
Yeah, people stayed away. They didn't want to.
They
yeah.
did. They did.
Yeah, it's a scary time.
Where did you get your master's?
Spring Arbor.
And
Spring
you
Arbor
grew up
University.
here in Jackson?
Yep. Went to Jackson College, and I became an LPN, and then went back for RN, Jackson College, and went to Spring Arbor for my master's degree.
Nice. And you went to Jackson High?
Mm-hmm.
Mm-hmm. And Clara, you went to Western
I
High
went to
School?
Western High School, yes. And then I did get my LPN at Jackson College. I went through the transition program for the RN. And I did the transition because I took classes waiting for the RN program, but there was a gap. They only admit so many students. So I'm like, what am I going to do for another year? So I took some additional classes and then went through the transition program, which is a nice program, shortcut to get your RN.
Yeah, it's
Yeah.
it's competitive to get into the nursing program
Yes.
at any school.
Yeah.
But I think we're pretty lucky here in Jackson. We have both Jackson College and Spring Arbor University that offer nursing education.
Yeah.
Mhm.
And you're able to stay in your own town.
Yeah.
Right.
Bonus.
Staffing. People are looking outside of the country to staff their hospitals and facilities because we just don't have enough nurses. What would you say to someone that might be considering, nursing for a profession?
Oh my gosh. If you have passion to take care of somebody, or you want to take care of somebody and just make a difference in someone else's life, give it a shot, give it a try. You never know. I didn't know what being a nurse meant to me until I did it. So I had to do it. And once I worked at it, I just figured out how I fit in and how I could make a difference. So.
And Claire, would you also be encouraging people to explore the
Oh,
profession?
definitely. It can be very rewarding in so many ways. And if the hands-on is not always for you, there are so many avenues that you can go through with nursing. I mean, you can do more teaching, you can do more admin. And what I definitely like about my portion of women's health is I can teach. And I see these ladies return, and they do take some advice, and they keep coming back because they're comfortable with the same face. So, definitely. There's a little bit of everything that a nurse can do.
And you make such a connection. Nurses that I've had experience with, they act like they want to get involved in my life. They really make a connection, and that it seems like that's part of the education, isn't
Well,
it?
it just makes it easier for all of us to just do what we need to do if we know a little bit about each other. So.
Yeah, and it's really when people recover or leave the facility or their memory, one of their strongest memories is the care they receive from their nursing staff.
Definitely. Yeah.
Well, the Center for Family Health about to welcome a brand new administrator, new CEO is joining a little
We're
later
excited for
this month.
that.
Yeah.
Yeah, we're excited.
Summer, so we've gone through the flu season. Are we done with that?
I hope so.
Yes. Please.
But we're still vaccinating for COVID, right?
Yep. Getting caught up on boosters if needed.
Boosters. And we're I think it's just one booster now.
I think there's different rules. We always have to check
Yeah,
every
different-
time.
Yeah.
different ages, different.
Yep.
Yeah. So how did we get through the winter in terms of what you saw for respiratory illnesses, COVID, flu?
Well, luckily we're in women's health, so we don't get really sick people at all. So we're almost kind of oblivious to that part of it. I think we just keep people all up to date on like their routine health maintenance and making sure our pregnant patients stay healthy. And if we do have someone sick, we usually send them off to our walk-in clinic. So they could probably answer that question better than we could.
And there's some openings. I think there's always openings.
Always openings, yes.
And there's always openings for new patients as
Always,
well.
yes. Yep, and we can work you in.
Well, thanks for being with us here today as we
thanks.
can
Thanks for having us.
honor all nurses
Yes.
during National Nurses Week. Thanks for your commitment to the Center for Family Health, our community, and to women's health.
Thank you. Thanks for having us.
Thank you.
From the Center for Family Health, RN and nurse practitioner Tessina Christensen, and RN Clara Van Duzen.